Okay, good evening, everybody. I congratulate you on coming out for this, braving the weather and other factors. We've started to have in-person programs here starting in September. And I can tell you that we've had decent turnout, but you folks now have the record. So congratulate yourself. So I'm Michael Bellicosa, Community Engagement Manager here at the Wilton Library. And on behalf of our Executive Director, Elaine Tyloria, and all of us at the library, welcome to this evening's program, Medicare Bootcamp. For the last several years in October, just as the Medicare open enrollment gets started, we've offered this program in collaboration with the Southwest Connecticut Agency on Aging. A couple of quick things before I introduce the speaker. Please make sure your cell phones are off. Keep your questions to the end so that the presentation can flow smoothly. And I see you've all got masks on. That's the library's protocol. It's optional for speakers, but for the audience, please keep your masks on. Our speaker this evening is Claire Volain, the Choices Director at the Southwestern Connecticut Agency on Aging. Claire's been with the agency for 3 years and has been in the human services field for over 10. The Choices program offers free, unbiased, confidential counseling, education, and assistance to Medicare beneficiaries. And I'm sure Claire will tell you much more about it this evening. So please join me in welcoming Claire Volain.
How's my audio with a mask on? Is it okay? Yeah. All right, let me know if it's easier without one. So I tend to walk around, so I'm working on staying still because the presentation is being recorded. My name is Claire Volain. As Michael said, I'm the Choices Director at the Southwestern Connecticut Agency on Aging. And thank you for coming tonight. I know it was very wet outside. There we go. One more time. So the Agency on Aging is one of 5 agencies on aging in the state of Connecticut, and these are across the U.S. as well. There's many of them around the U.S. And we cover Monroe to Stratford down to Greenwich and everywhere in between. We are a nonprofit, so our agency gets most of our funding from the Older Americans Act and the State Department of Aging. So we're not selling anything. As a part of our work with Medicare, we're a nonprofit and we have trained Medicare counselors. Some of the other services that we have through our agency, if you haven't worked with us before, we also do provide social services around home care and keeping folks safely at home if they would prefer to be at home instead of in a nursing facility. We have services around nutrition, around caregiver support, and many other things. So my department specifically, Choices, we are a state health insurance assistance program. And this is a federal program. The federal government said Medicare is complicated. So we have these all around the US as well. And as a part of our role, we provide counseling around enrolling in Medicare for the first time, navigating enrolling in a new plan each year, or looking for savings with a plan, navigating other benefits associated with maybe Medicare or Social Security or Medicaid. And then also, if you ever encounter a complicated Medicare problem, you have a problem with coverage for a medication that you have, you are concerned about appointment that you had and some issues with billing, you name it, we can help answer questions. And I'll certainly introduce Ellen and Lauren in the back here. At the end of the presentation, they wanted to say a few words, but you are very lucky to have some Medicare counselors in Wilton that are available through our program, and they're really wonderful. So anyway, that's just sort of a summary of what we do. Okay, so I just wanted to mention If you're on Medicare, I know that this is going to be a mixed group, so I'm trying to gear it towards both those who are new to Medicare and those who are already on it. If you are on Medicare, every year before the open enrollment period, before the new year starts, you get one of these in the mail, or you should. I've heard of some people not getting them this year, but you should be getting one in the mail every year. And these are a really great resource. These documents, or this pamphlet goes over all the details about Medicare, and it really highlights a lot of questions that you might have about enrolling in it and navigating the different parts of it. So for those of you who are currently on Medicare or enrolling next year, a couple of updates from Medicare specifically, which is the federal health insurance program in general. One update is COVID-19. It continues to be a public health emergency, and as long as it is, testing and treatment are covered through Medicare. In addition, of course, vaccines are covered as well. There is an addition of a cognitive assessment at your yearly wellness checkup. With Medicare, you get a yearly wellness checkup, and this will be a part of that now, and that's covered. And if there's any concerns around cognitive impairment, then you would also have a covered visit to a specialist. Another update is the addition of a blood-based biomarker test for colorectal cancer screening. Right. So I just wanted to mention a little bit as an aside from this about Medicare's preventative services and their coverage. So as a part of Medicare, in addition to your yearly wellness checkup, there are many different tests and screenings that you are entitled to, and it would be something you would talk to your doctor about, your regular doctor. So here are some of them. Bone mass measurement, breast cancer screening. Let's scroll through here. Screening for diabetes, of course, flu vaccine, glaucoma test, hepatitis B vaccine, lung cancer screening, things like that. So just a couple of the preventative benefits that you were eligible to access. So today I'm going to talk a little bit about the annual enrollment period that's happening right now. And also this is certainly geared towards someone who is turning 65 in the next year or so as well. And the annual enrollment period is from October 15th to December 7th. And this is an opportunity if you buy a Part D prescription drug plan, or you buy a Medicare Advantage plan, to change that plan if you so choose. And I just wanted to make a note about retiree coverage too. If you receive retiree insurance, make sure you talk to a benefits counselor before signing up for another option with Medicare, a private option, because this may affect your retiree insurance coverage. So this is probably the most important slide on here, and I would say sometimes the most confusing slide as well. So I like to think of it as two different roads with Medicare that you can go down. When you turn 65 or you retire, then you would sign up for Part A and sign up for Part B as well. So Part A is your hospital insurance. And if you needed to go to a skilled nursing facility as well, a limit on it, of course, but some coverage with a visit to a skilled nursing facility. So Part A and Part B is something that you would sign up with through Social Security. So that's one of the first steps if you're enrolling in Medicare is signing up for A and B. And I would encourage you before that to talk to Ellen or give us a call to talk through some different things, because signing up for Medicare is slightly different for individuals based on whether they're retiring, whether they collect Social Security or they don't. It can be different from one person to the next, so it's good to speak with a Medicare counselor. So that's Part A and Part B. Part D is the prescription drug plan option. So we're on the left side here. And then also an option for someone who is choosing this road on the left here is what's called a supplemental plan or a Medigap plan. So Part A and Part B, they cover, I'm sorry, and going back to Part B covers your medical visits, diagnostic testing, blood work, medical equipment if you needed it, things like that. So that's what Part B covers. And if you are on the left side here, then say if you, for example, went to the hospital and you had a bill for $10,000, Medicare is covering $8,000 of that. And they would ask you to cover the $2,000 of that. So what a good option might be would be to have this supplemental or Medigap coverage, and that helps make up the difference. So you pay a premium on that, and that would help you have that additional coverage. It's filling in the gap of what Medicare does not cover. It's a good way to remember that. And then Part D, prescription drug coverage, is something that you would enroll in to, you pay a premium and a deductible on, and that would allow for your prescriptions to be, a copay at the pharmacy. So that's the left side here. And then on the right side, another road that you can choose to go down is what's called a Medicare Advantage plan, or Part C. And a Medicare Advantage plan is A, B, and C all under one umbrella. So if you have had a private plan through an insurance company, anything like that, then that is similar. So most of them, and I'll get into that in a minute, most of them have prescription drug coverage associated with it. There are some, with the left side here, original Medicare, there's no coverage of dental, vision, and hearing, unless you're in the hospital. And then there's some limited coverage. So one benefit of choosing the right side of the road here is that dental, vision, and hearing are often an added benefit. Maybe $1,000 towards a dental surgery if you needed it, things like that. So those are some extra benefits, and I'll go into that a little bit more. And with a Medicare Advantage plan, you might see lower out-of-pocket costs, as a potential option as well. So when you're thinking about these two things, I'll go into a little bit more detail about the price differences here. When you're choosing a Medicare option, you want to think about your health, your priorities. Is it really important to you to have comprehensive dental coverage? Are you expecting to have a surgery coming up this year? Obviously, of course, you won't be able to predict everything, but some things to think about. Do you prefer to pay more in your premium and then maybe less out of pocket overall if you wouldn't like the surprise of a very high hospital bill, things like that. Some costs with Part A, and I'm just gonna give you some projections for 2022 for some premiums and deductibles. So for Part A, most individuals, those who've worked, those or their spouse who've worked 40 quarters or more in their lifetime are eligible for premium-free Part A. There's some calculations that Social Security would make if you are not, but you may have to pay for a premium. For a deductible for next year for Part A, it's projected to be about $1,500. And it was about 14 and change this year. For your Part B, the premium is projected to be, this year it was $148.50. It's projected to be $158.50. About approximately, just wanted to make sure to note that. And the deductible for Part B is projected to be about $217. So those are some projections. There's, of course, some deductibles and premiums to think about with that. One other thing I wanted to note about changes in premiums and deductibles. These are the national, changes. The cost of living adjustment for this coming year, you might have seen, has gone up significantly for the first, the highest it's been in the past 40 years. So if you collect Social Security, this adjustment has gone up about 6%. So that does usually affect, premium costs for everyone. So something I wanted to, I'm just going to go into a little bit more detail about Medigap plans. That's for the left side over here. And this is what fills in the gap of what original Medicare would not cover. So this is sort of small, but I'm happy to maybe drop off a packet of these at the library or something so you can pick them up. This document changes regularly. I'm sure Ellen has copies as well. So this is a sheet that we created, and this lists out all of the Medigap plans in the state of Connecticut currently. So plans are on the left here. Up top, you'll see some letters of the alphabet, and those are the plan options. I'm sorry, the insurance companies are on the left, the plans are on the top there. You'll see, maybe it's kind of hard to see here, but there are a couple on the right side that are orange, so I'll talk about those in a minute. Each plan, G, for example, say you went with United Healthcare Plan G, the coverage for that is exactly the same as Colonial Penn Plan G. So from Plan G to Plan G, the exact same coverage, just a different price. So if you really like Colonial Penn, it's a good option for you. But just to note that, they may be different prices, but they're the exact same coverage. Something else I wanted to add here, just gonna go over here for a second. We'll use Plan G as an example again here. So this is the back of this document, and this goes over what each of these plans cover. So for Plan G, for example, it covers Part A coinsurance and hospital costs up to an additional 65 days after Medicare benefits are used up. Part B coinsurance or copayment, blood first 3 pints, and so on and so forth. So you're just looking here, the first thing that it does not cover, only covers 80% of it, would be if there was a travel emergency. So that's what it looks like. And on the right side here, you'll see those 3 plan options that are in orange, I believe, for your screen. Those plans are being phased out. Anybody who's already on them or who turned 65 before the 1st of January 2020 can remain on that plan for forever if they'd like to. But anyone new to Medicare cannot apply for these plans. Some other things I want to note about Medigap plans. This is a little bit different in terms of enrollment. It's something called continuous enrollment, which means if you were on the left side, original Medicare, and you were unhappy with your Medigap plan and you'd like to go to another Medigap plan, you can do that at any point during the year. It would be effective usually the following month. You can change it at any point to another Medigap plan. You may have heard this before from other states. Many places around the country, you can be told that you cannot get on a plan or you have to pay more if you have a pre-existing health condition. And in the state of Connecticut, that is not true. You don't have to pay more, and you aren't denied a plan based on a pre-existing condition. So you might see that on the internet for the state of Connecticut. That is not true. So that's here. The last thing I want to note here, one other thing about pre-existing conditions with Medigap. For certain individuals, folks who are on Medicare, under 65, things like that, they may have a small waiting period with their pre-existing condition. That's the only thing that someone might encounter. But if you're already on a group health plan, if you're already on a Medicare Advantage plan, if you're already on Medigap and you transition to a plan, then you shouldn't have a pre-existing condition waiting period. So I just want to talk a little bit about the left side again, the Part D prescription drug plans. So for 2022, there are 21 private plans to choose from for a standalone drug plan. The monthly premium for these is quite a range, about $7.40 per month, or $136.20 per month is the highest one out there. If you don't take any medications or you take very few, something on the lower end might be a good fit for you. But that would be something you'd want to maybe look into based on the medications that you're taking, making sure that everything is covered. The drug deductible that you'll need to meet ranges from $0 to $480, depending on the plan. And just a note for those who are already on Medicare, Express Scripts has merged with Cigna. So if you had Express Scripts, you should have already gotten something in the mail telling you that you are now under Cigna's plans. And you're automatically enrolled in something under Cigna. WellCare for this past year had 8 plans available, and for this coming year, only 3. They reduced the amount of plans that are available, and you should have already gotten something in the mail if you are on WellCare, if you had to transition to a different plan. So some questions to ask when you're thinking about a prescription drug plan, if you're picking one out. First and most importantly, are your drugs covered? Is the drug on what's called the plan's formulary? Are my drugs under a different tier? Say if you're taking levothyroxine, for example, and it may be tiers, the higher the tier, the more expensive the drug is. So tier 5 might be the most expensive, tier 1 might be less expensive. And if one plan, maybe WellCare, offers levothyroxine at a tier 2, and another plan option, maybe Express Scripts offers a tier 1 for that particular medication. Do any of my drugs have restrictions? Those could come in the form of quantity limits. So maybe they say you're only able to get only 30 pills in a given period. Something called step therapy, which means that you might have to try out some other options before you're covered for the thing that you might have been taking, or you might be told by your doctor that you need to take. And then also if you need to get prior authorization for a medication, and that's something that you would prefer to avoid. Maybe one plan requires that and another doesn't. Lots to think about. And then is my pharmacy of choice a network? When I'm counseling individuals, I encourage them to maybe think within their travel radius, how far out they might go from their home. A couple of options. Maybe they prefer to always go with CVS, or they're willing to go to any of the 3 pharmacies within a mile radius of their house. But if you branch out, you might find that one pharmacy might be $300 cheaper for the year than another. It depends on the pharmacy. Even from one CVS to another, sometimes the cost difference can be there. So something also to consider too. And then also what's called the coverage gap. If you have a high cost medication, you might enter something called the coverage gap. And that would be you're paying into your deductible, you're paying your co-pays on your medication, or you're paying, a higher amount for that medication. And after a certain limit, let's say maybe $3,000, you enter this donut hole. And in that hole, you might have to pay more for that medication. The plan might ask you to cover more, maybe up to $5,000. After $5,000, the plan would cover that medication in full. So that might also be something that one plan might have you go through a coverage gap and another plan might not. So we're going to switch gears to the right road. We're going on the right side of what we were looking at earlier, and that is Medicare Advantage plans, or Part C. So again, these are A, B, and D under one roof. So your Part A, your Part B, you might have a premium, an additional premium, in addition to the $148.50 for this year, or maybe there's no additional premium for that. You might have a deductible for your hospital visit. Maybe it's a lower cost, maybe it's a lower cost to you, but you might still have a deductible. You have your prescription plans included. There's 29 plans, Medicare Advantage plan options in this region for this year. And 26 of those include prescription drug coverage. So that's sort of as part of the package. Some extra benefits. Again, I had mentioned dental, vision, and hearing tend to be extra benefits with these plans. Some plans, again, also include lower out-of-pocket costs to think about as well. So one very important thing about the differences between Medicare Advantage and original Medicare, so going down those 2 different roads, Medicare Advantage plans Medicare gives you a wider network of providers that you can see. A provider that accepts Medicare, you might, you would be able to access them, which could take you, further in terms of if you're seeing lots of specialists, or you're, you're going to the hospital regularly, things like that. Medicare Advantage plans mostly fall under these first 2 here, Health Maintenance Organization, or HMO, or Preferred Provider Organization, PPO. And HMOs are more limited networks. So the plan says you must stay within our network. For example, Connecticut. They say you must stay within the Connecticut network, any hospital, any doctor that you see. With preferred, oh, sorry, and in the case of an HMO, if you did see someone outside of that network, you would be paying the full cost of that. With preferred provider organization or PPO, you are allowed to go out of network for a slightly higher cost. So for example, if you went to a specialist in network, it might be a $25 copay. If you went to a specialist out of your network, it might be a $45 copay. Here. Oh, and I'm just going back here, I'm sorry. Special needs plans are plans specific to individuals who are on Medicare and Medicaid, who might have special health needs. So again, here are some of the benefits. There are some benefits if you are a snowbird and you like to travel. There's some additional benefits in terms of travel. Again, dental cleanings, vision, hearing exams, things like that might be covered. Maybe partial coverage for a hearing aid if you needed it, or partial coverage for dentures. Other things they might throw in, they might say, here's some over-the-counter, here's an extra $40 every month for over-the-counter medications that you might be taking, the Advil you're taking, things like that. Also, they might give you back part of your Part B premium, that $148.50. They might tell you they're giving it back to you. They might offer some telehealth appointments, things like that. So some questions to ask yourself when selecting a Medicare Advantage plan. Since most of them have the drug plan included, you would likely ask the same questions about the drug plan and whether the medications were covered. Are your doctors and hospitals in network? I encourage research into that with our help or with Ellen's help, looking into that yourself. I encourage researching that. Do you need referrals to see specialists? Is that important to you to avoid? Do you need prior authorization for some services? And what are we looking at in terms of the total plan costs? Most of the individuals I work with, we do a little math, and maybe the choice that they're making is a cost one. For some it is, I really want this benefit, or I really prefer to go with this company. I was with United Healthcare when I was employed, and I'd really like to stay with them. There's lots of different things that people would consider. So when you were comparing these, now that you've seen these two different roads that you can go down, you might find your information from your current plan if you have one. You might find it from the plan themselves. You can call up a plan and ask them questions. You can grill them. You'll certainly be getting a lot of mail if you don't already related to Medicare, mail, TV. There's certainly some brokers and folks like that out there who provide this information as well. Another great resource for finding out what plan is right for you is Medicare.gov's website. You can sign up for an account there, and that allows you to save, if you're comfortable with that information being on there, that allows you to save all your medications in there, and it tells you what plan you're currently on, and you can research whether Medicare covers something. It's a great resource. And then also, most importantly, you have the wonderful Elena Bend from Wilton, who could also provide, and of course Lauren Hughes, who could also provide this information to you as well. So some places where you can find the information. So this is what the website looks like. You don't have to have an account to find out what plans are available for 2022. and whether your medications are covered. So you can click on this button here, Preview 2022 Health and Drug Plans. And this is really only looking at prescription drug plan options and Medicare Advantage plan options. If you would like a Medigap, then you'll have to look at that separately. For example, the sheet that I showed earlier. So once you click on this, you can click through, type in your medications anonymously or with an account, and you can see which plans cover it, and in some detail also what your total estimated yearly drug and premium cost would be. It can help you kind of summarize the differences, and you can actually switch back and forth between, if you're trying to decide which road to go down, you can switch back and forth and kind of look at your cost options that way. So something to consider with making a decision, a plan might offer a lower premium, maybe higher out-of-pocket costs, or maybe a higher premium and less out-of-pocket costs. And this MOOP here, that's what we call it in our office, is what's called maximum out-of-pocket. And many plans are saying basically that we will cover you after the maximum out-of-pocket of $7,000, for example. And what that looks at is any out-of-network costs that you have, any premium costs that you have, any specialists that you have, anything like that. It's everything. If it reaches $7,000, and after that, they're covering it. So this is kind of small, but the point I want to make about this screen here is on the left side, this is a $0 premium plan. And the maximum out of pocket for this one is about $6,700. And on the right side, there's a $91 premium that you need to pay per month, which comes out to about $1,000 a year. But the maximum out of pocket is $4,700 a month. Yes, I'm sorry, yes, a year, $4,700 a year. It's past my bedtime. There's a lot, again, I mentioned this before, there's a lot of information that you're going to get. I have said, some people have told me that they get harassed by that in the information that they see. I see it on billboards, I see it on the TV. You know, ever since I started working in this field, I seem to find it everywhere. So I'm just going to tell you a little bit about what you might want to keep of the things that you're going to get. So you're going to get something called an annual notice of change every year. And that annual notice of change probably comes around the end of September, beginning of October. And this tells you, if you're already on a plan, what to expect for the next year. Different premium, perhaps, maybe it goes up $20. Are your medications that you're currently on still covered? And maybe if there's a change to a deductible. So keep this, review it every year. If you are satisfied with the plan that you're on, if you don't want to make any changes, you could certainly continue with the plan that you have. And if that's the case, you don't need to do anything. You just continue on with the plan. You don't have to call to renew or anything like that. It's automatic. But I encourage you still, we often find, even for folks who've been really happy with their plan for several years, they went through the process of comparing the plan they have with other plans, and it turns out that now they could save another $5,000 by switching to a different plan. And the other thing that might be beneficial, which is not normally mailed to you, but you can request, it's not normally mailed because it's 300 pages. And you can also find this online too, if you don't mind a PDF. The evidence of coverage is a much more detailed explanation of what this plan actually covers. So on Medicare.gov, for example, which is a tool that we use often to help you figure out which plan you want, it may say dental coverage offered or some dental coverage. You probably understand that. And then when you look in this evidence of coverage, you might find that some dental coverage equals $500 towards your dental costs. Or maybe it's $10,000 towards your dental costs. You know, it just, this can help you figure that out, and we can certainly help you research that. I'm sorry that this is also small. So something really important about navigating Medicare is you know, solicitations and frauds and scams and things like that, and just being aware of that, especially during the open enrollment period. It's a big time for fraud and scam situations. The first thing I wanted to note is some things that agents and brokers cannot do with you. They can't announce that they're from Medicare. They have to tell you where they're from. If they called you up, they can't solicit you, or they can't contact you unsolicited. So they can't knock on your door out of the blue, but they could send you something, and it says on there, you know, talk to us about Medicare, check yes if you want us to talk to you more about it. If you check yes and send it into them, they can, that's giving them permission. If you know, you could certainly have them do that if you'd like, but just so you know, it's giving them permission to contact you as much as they want. So those are some things to think about. Again, they can't knock on your door, they can't hunt you down in the parking lot, things like that. So you could certainly contact them if you wanted to, but they have to, you know. Did you have a question?
I would say at least 6 phone calls a day. Medicare Advantage. They're requested phone calls, whether it be the cell or outside.
It happens a lot, and it's because they have very, very sneaky ways of getting permission to, and perhaps they don't have permission, but even if it may even be not a checkbox, it may even be just an email or an original phone call, something like that. So they shouldn't be doing that. But it's a good note for me to get into, because if you think that they are not doing that appropriately, we have someone devoted to in our office to situations like that, and can sort of take that up the food chain. If that happens, we have the ability to file a complaint with a plan if they're not acting appropriately for some reason, or a broker, for example. So if you think that that's happened to you, you can certainly contact us. The information on here, you could certainly talk to Ellen or Lauren as well, and they could get in touch with us too. I'm just going to go through this very quickly. I'm just going to touch on this a little bit more first. So this is called Senior Medicare Patrol. This is the, you know, the person you can contact in our office. Her number is on the bottom here. 814-3618 is her number. She also would help you navigate if you thought you were a victim of fraud or a scam. This might look like, for example, make sure you review your quarterly summary of the services that you received, because sometimes scammers will bill you for something that you didn't receive, or maybe even a doctor misbills you for something, intentionally or unintentionally. Just keep an eye on that quarterly notice so that you can take it to the next step and try and get that resolved, fix that. I've heard of people, for example, maybe their plan allows them once every 4 years to get a new hearing aid as covered by their plan. But if somebody, a scammer, billed them for a hearing aid, they may not be able to, for 4 years, get a new hearing aid again. So that does happen. Make sure to keep your Medicare number close to you and avoid, if you can, handing that out on a regular basis. Ellen, myself, we're all trained to handle secure information. We really keep everything. My voicemail is secure, my email is secure. We really keep everything as protected as possible. But just another note about that. Medicare is never going to call you out of the blue and ask you for your Social Security number and your Medicare number, unless you are working with them directly on something. For example, you're appealing something that you would like them to cover. They might contact you because of that, but there are millions of beneficiaries that they have, so they wouldn't contact you out of the blue just to ask you for your number for something. And if you think that might be Medicare, you're not sure, you'd like to ask, again, this phone number at the bottom, you can always check with someone too. I just got a phone call. I'm not sure if it was right for me to give them my Social Security number, and we can talk you through that. I'm just going back here. So to conclude talking about this regular enrollment period, so every year, October 15th to December 7th is an opportunity for you to review your plan currently and enroll in a new plan. If you're new to Medicare, you have a special separate enrollment period, but this is for anyone who's currently on Medicare. So around the beginning of October is when you'll get all that information, and hopefully you can sit down and review it. And then you have between the 15th of October and December 7th to make that change, which would start on January 1st of the next year. Something else, and just to go back there. So between October 15th and December 7th, you can change from a Medicare Advantage plan to original Medicare or back. You can do that as many times as you want to over your lifetime, but you have to do it once a year. You can switch, again, of course, you can remember you can continuously enroll in a Medigap plan from one to the other, so you could change to another Medigap plan from one to the other, but you could do that another time in the year. This would also be the time for you to look at your prescription drug plans, the one you're currently on, if you wanted to change it, or if you wanted to switch to a Medicare Advantage plan. And certainly also if you're on Connecticut's Medicare Advantage plan and you'd like to switch to another option. So this is the time that most of what you would do with your insurance would occur. Between January 1st and March 31st, you also have the opportunity to do a little bit, it's sort of an extension for a couple of things. You can also change from one Medicare Advantage plan to another. I just wanted to make this note too. This is a really valuable state program that we have. The state of Connecticut offers a very comprehensive assistance plan for those who financially qualify. And this basically acts like a state covered Medigap plan. So it pays for your Part B premium, and in some cases, co-insurances, co-pays, and deductibles for whatever Medicare doesn't cover. And as you'll see up here, those are the income guidelines. So for an individual, $26.41 is the maximum you can make a month to qualify. And this includes your Social Security income if you have it, your pension if you have it, and then only half of any working income that you have. So that's how you determine if you're qualified for that as well. So if you're a part of that program, you're also automatically enrolled in something called LIS, which also helps you pay for your prescriptions. Makes them very low cost, about $3 for generic and about $9 for name brand. So I just wanted to put my email up there. I just wanted to also make note of our department's email. And then these are our phone numbers. Either number you could call and you'll get us. We have sort of a hotline, if you will. We get about 30, 40 calls to our office on a given day about many different things, but many of those topics are around Medicare. And because we have a high call volume, we ask that people leave a message, we call them right back. So we have their information, we make a note of it, and we call the person right back. But as I had mentioned, you have some wonderful resources right here in Wilton as well. I would also direct you to. So that's it for my presentation. I would like to offer the opportunity for anybody who'd like to ask some questions.